what exactly is obstructive sleep apnea?
It is a part of a group of sleep disorders and happens to be the most common. The general population is probably estimated about 20% of Americans have it and increasing every year.
People make poor diet choices with fragmented sleep. They don't get to a level of sleep called N3.
Our processes aren't working effectively and efficiently. We're not restoring and rejuvenating our bodies if we're not sleeping properly. Hi, and welcome everyone. My name is Dr. Asha Pai-Bohannon with the Patient Advocacy Initiative podcast. And today I am really excited to have two wonderful practitioners with me today. Dr. Joseph Newman. He has been a practicing nephrologist for many years and is founding member of the Eastern Nephrology Associates in Eastern North Carolina. He's found a new passion in diagnosing and treating obstructive sleep apnea in patients with efforts to slow the progression of chronic kidney disease. And I always have a fun fact or a fun little tidbit on my guests. So Dr. Newman is an avid golfer in his time off, and he's actually here with us on his day off today. So really appreciate him being here. And is also in the process of writing a fiction novel. So I'm excited to hear a little bit about that too. And then we have Shannon Guthrie also. So thank you for being here, Shannon. She has been a registered dietitian for 20 years, and the last 10 years has been in the kidney field. She enjoys educating patients on how they can improve their health and in turn their kidney health, and has joined Dr. Newman's effort in addressing and diagnosing and treating obstructive sleep apnea in patients. Her fun fact is that she enjoys spending time with her daughter and family, cooking and exercising. So with that, I'd like to welcome both Dr. Newman and Shannon to the Patient Advocacy Initiative podcast. Welcome. Thank you for being here.
Thank you.
Thanks for having us.
So I'm going to start with a question about today's topic is obstructive sleep apnea. And we all know that sleep plays such an important role in so many things, chronic disease, chronic illness, when we talk about chronic kidney disease. So I would love to start with the question, what exactly is obstructive sleep apnea? And I'm going to shoot that over to you, Dr. Newman.
To be honest, 2 years ago, I really didn't know much about it. I've learned in the last two years, but it has largely been ignored. It is a part of a group of sleep disorders and happens to be the most common. And it's associated with obesity, but people don't have to be obese to have it. And it's true. It's if you have symptoms of waking up tired and fatigued during the day and you snore, you likely have sleep apnea. And the general population is probably estimated about 20% of Americans have it and increasing every year. There are 500 million diabetics in the world, but 1 billion with sleep apnea. So it's an increasingly frequent process. In sleep apnea, the most common type is obstructive, and literally a patient's pharynx will close and they literally can't breathe. They try but can't breathe. That's where the snoring comes in. The other type, there's a type called central sleep apnea. And that's what we see in people that may have strokes or heart failure. And there, the brain literally does not tell the diaphragm to breathe. And they just sit and lay there and don't breathe. That's less common, about 20%. By far and away, 80% of apneic patients have obstructive sleep apnea. And it's increasingly frequent.
It is. I'm actually seeing it more and more and more in my patients and my diabetes patients. So I'm glad you brought that up. And without sleep, there's not a whole lot that our processes aren't working effectively and efficiently. We're not restoring and rejuvenating our bodies if we're not sleeping properly. So with that, I would love to hear from Shannon. How do you guys diagnose this? I know you gave some of the signs and symptoms, but what are you looking for when it comes to the obstructive sleep apnea?
Most of the patients that are coming that I see from Dr. Newman, this has already been addressed. He's already selected and either tested or talked to them about it. When I talk to somebody, I ask the typical stop bang questions. Have you heard of stop bang?
I would love for you to explain that.
Okay, it's a series of 8 questions that you ask a patient. And, the first one is, have you ever been told that you snore? which is S. And then T is, are you tired? Do you often feel tired, fatigue, or sleepy during the day? And then the O is obstruction. Do you stop breathing or choke or gasp during your sleep? P is for pressure. Are you being treated for high blood pressure? B is for BMI. Is your body mass index greater than 35? A is for age. Are you greater than 50 years old? N is for neck. Do you have a neck circumference greater than 16 inches? And G is for, are you a male? So,
Okay.
50% of the people can say yes to one of those, I'm sure. But so I kind of go through that first of all, and then I look at physical symptoms such as, they having swelling, are they having uncontrolled diabetes?
And the stop bang is a recognized test across the medical field for diagnosing sleep apnea. So
Okay,
if you
that's where we
fit those
start then.
criteria, you should be checked. Yes.
Yes.
Okay. So once you get somebody who has, I'm going to say past the stop bang, so they're diagnosed as somebody that probably has OSA, then what is the next step? What would be the next step in that process?
Well, with me, when I'm speaking to patients, I say, have you ever been tested for sleep apnea? And do you know what that means? And, I'm a big proponent of, that we use a home sleep test company, and, we'll, fill out the referral form and send it in, and then they take it from there. They actually ship the device to the patient, and then they do the test at home and upload the data, and we get the results. But I also explain, coming from a dietitian's perspective, and Dr. Newman will speak to his perspective as a physician and why it's important to treat it. The research has shown that people make poor diet choices with fragmented sleep. They don't get to a level of sleep called N3. And I've actually seen it on more sophisticated tests, sleep tests. They never reach that point, or if they get there, it's like such a short amount of time. And it shows that people are, eating and drinking more confectionaries, getting those simple sugars. They're tired. The body's tired. It's looking for that fuel. And they also will eat more red and processed meats, which I find really interesting. And then I'm also reading more about how the fragmented sleep also leads to more gut dysbiosis, which is, the bacteria balance in your gut that helps with, clearing of toxins, general GI health, and immunity. So it's actually affecting a lot more than just being tired during the day. With Dr. Newman, when he sees people, and this is what brought him into sleep apnea, was, we have meds that control hypertension and control diabetes, but yet we still have progressive kidney disease. And he started looking more and more into why.
About 2 years ago, I noticed, in fact, I came up with a new syndrome called the perfect storm. And on a website that Shannon has, I've written a blog about the perfect storm, your ticket toward dialysis. And it's involving high blood pressure, diabetes, obesity, and the fourth unrecognized part is sleep apnea. And I noticed that 2 years ago, seemingly every patient I saw had those four things. And the sleep apnea was largely misdiagnosed, underdiagnosed, not treated, not recognized. And yet it's the most harmful thing I've seen in practice in 30 some years. And then with COVID, the insurers and Medicare allow us to do home tests so more people can be tested. And that means more people are going to get treated. And I am convinced that will slow down progression of kidney disease. I have no doubt about it.
Well, and I think too, with the home sleep test, it's more convenient. You don't have to go to the sleep lab. It's less intrusive. I think you get a more clear picture, true picture of a patient's sleep
status,
they're in their own environment, so it's super convenient than it was in the past in the sleep lab. Now, if they have a true clinical thing, then maybe they need to be looked at a little bit deeper, but for your general diagnoses, and I think a lot of times people they don't want to wear the mask. I think that's another thing, like they don't want to face that, or, and there are other things besides CPAP masks that can treat sleep apnea too, that have come out. So those are things that we discuss with them.
I love that. So thank you you literally answered all the questions that I was getting ready to ask. So, no, I love the fact that you said that it's now more evident that you can do things from home. So a lot of people are a little nervous about having to go into a room and unfamiliar room and do this kind of study. So doing it from home is going to increase that amount of people getting recognized for this. And then the fact that there are other modalities that you can use besides the mask. But, I think it's really important to readdress exactly what you said, which is sleep affects every single ounce of our bodies. And it's not just, I think when people think about it, they think of the sleep routine. And everybody talks about that all the time. It's all, don't be on your phone an hour before bedtime and those kinds of things. Like, what is your routine? That does impact your falling asleep, but what actually happens once you fall asleep is just as important. And so a lot of people don't recognize that, or if you are, you sleep alone, you don't know, are you stopping breathing? Are you snoring? You don't know those answers. So it's really important to kind of get those tests if you suspect that this might be going on, if you're waking up tired, if you're waking up. So all really great information on. So what is, what I always like to do is at the end, just give you guys a couple minutes to share whatever it is about obstructive sleep apnea that you want to share, and then let people know how to get in touch with you and your practice and what it is that you do for patients in the chronic kidney disease with OSA.
I would say that, obstructive sleep apnea is so important because the issue at hand most times is hypoxemia, oxygen levels in bloodstream. And the organs, the kidneys, the heart, the lungs, the brain, the liver, they need oxygen 24/7. If they don't get it, tissue starts to die. So it affects not just the kidneys, but the entire body. But it is largely unrecognized. People do not want to use the mask. They don't want to go to sleep labs. Now that's culture's trying to change. There are other ways of treatment, but if patients have any of those issues, they should be checked because very likely they have it. In my practice, I used information I've gained through sleep tests for the last 18 months and come up with about a third of our patients that we see have sleep apnea, and most of those don't know it. And that's where we're trying to start now. And that's about 6,000 patients just in our practice.
Wow. Yeah.
So, and I'm sure they do not know it.
Most people do not know. Yeah.
They do not know it. It's not talked about. Doctors don't want to talk about it. It's a burden because patients don't want to go to sleep labs. They don't want to wear that mask. They don't understand why it's important.
Yeah.
And they just say, let's just sleep. And why does that matter? Well, it matters because you have a higher incidence of strokes, heart disease, and kidney disease, and high blood pressure, and diabetes. It's the whole package. It's part of the perfect storm.
Yeah. And if you're tired, you're not going to want to go exercise. You're making poor diet choices. It's just this vicious circle. And, I do have a personal story about sleep apnea. I actually, Dr. Newman's heard the story a lot, but I take it, this is why I have enjoyed partnering with him and supporting him in his effort with this type of patient. I diagnosed my mother with sleep apnea. I was in a short story. And so she went, I said, Mom, you need to go get tested. And, she went and tested. She told the pulmonologist, my daughter was the one that sent me here. And he said, well, she has saved your life. Right. So I take that really to heart. And so, she's very compliant. In fact, for one Mother's Day, I bought her one of those So Cleans. So it will clean the machine for her so she didn't have to deal with it anymore. And it's not a very, exciting gift, but I really wanted her to have good treatment. Well, then, there's a new realm of medicine called remote patient monitoring. And so we gave my mother, she said she'd be a guinea pig for us. And we gave, we gave her a device and was monitoring her for various reasons. And we kept noticing that her O2 levels were not optimal, and we were like, well, this is strange, here she is on CPAP, and no matter when we would change the settings, nothing would really change, so we decided to just monitor her O2 with a true oximeter. And what we found was that she was hypoxic still, even with the CPAP. And so that was really interesting. And then when we look closer we bled in a liter, we got O2, bled into her CPAP, corrected the hypoxia. We did another oximeter test. But what was really, really interesting was for her, she was tachycardic. I don't know how much of the night, 20 minutes?
A good portion of the night. I mean,
Her heart was,
rapid heart rate.
and that completely corrected that.
Yeah.
Wow.
So even though that was happening every single night, so
And that,
I'm a
builds
huge,
over time.
and so I'm a huge believer in treating it and then looking at the O2 levels too.
Diving deeper. Yeah. No, thank you for sharing that, Shannon, because it's interesting. So we're talking about just the initial getting diagnosed, right? Like that's highly important.
Yeah.
But even then, and I will tell you from the people that I have interacted with that have been diagnosed, nobody's going that extra step. So even some of those people, while it's helping for sure,
Yes.
to some degree,
I agree.
it can go even further, and you can actually diagnose even more and do more. Because the point that Dr. Newman and you both just mentioned is that hypoxemia is what's really getting, and that's why you're saying you're seeing this perfect storm in patients. Because
I'd like to add something to that.
Yeah.
The standard of care revolving around the sleep apnea is the AHIs. How many times per hour you stop breathing? And even pulmonologists will tell you if your patient has an AHI less than 5, they're doing okay, but they're not checking for hypoxemia.
Right.
So if I have patients that have known sleep apnea and they have these symptoms, I check them, and we're finding a lot of those patients have hypoxemia.
Significant hypoxemia.
So
That's like the next step in all of this that people are missing.
And that's exactly, because the real key is hypoxemia. That's the problem. That's the issue.
That's what's deadening the tissues and everything.
Yes,
that's progressing these diseases.
That's a central issue about sleep as well, but for physiologically, it's the hypoxemia, and it kills tissue. And your body needs oxygen.
And sometimes, based on the tests we've been finding, sometimes just the CPAP will correct everything.
Yes.
The hypoxemia, the AHIs, and you're like, okay, great, you're good. Some people need a little bit more, to looking at. And then we've also found people who have low AHIs, right, don't qualify for CPAP, but they're hypoxic. And
so
they
both. You got to look at both.
We treat them too.
We treat them too, and they wear O2 at night.
Wow. Okay. This was really informative to me. Because really it's very surfacey. My knowledge on OSA has been very on the surface. And so this has really enlightened me to be able to talk further with my patients about that. So I'm really excited to learn a little bit more. You did say that you have a blog called The Perfect Storm. Is that right? Or
yeah, Shannon has a website and we've written blogs, and on that, and one of the blogs is The Perfect Storm, your ticket to dialysis.
Yes, I am going to put that in the show notes for this because I want everybody to read what that perfect storm looks like. And then if you just want to briefly say how we can get in touch with you, and then again, I'll put your information, both Eastern Nephrology Associates as well as Sound Nutrition. And we'll put all of that information into the show notes so everybody can have access to both of you. So what's the best way to contact you?
Well, you can reach me through email at soundnutritionnc@gmail.com.
Okay.
Or you can...
I would rather just have you contact her.
Okay.
We're in the process of making this into a project, into a business. So I'd rather not have sent to my office right now. We're having negotiations and talks starting now.
Perfect.
So I send it to her, communication, and she'll let me know. She'll keep me informed.
Yes, I love it. Oh, thank you guys so much for being on here today and taking the time to be here. I know this is going to be really great information and people are going to want more and more about this. So this is probably going to be a continued discussion. We could have a whole discussion on hypoxemia alone. So I would love to.
Anytime.
Thank you so much. All right. I will have everything in the show notes. Thank you again for being here.
Of course. Thanks for having us.
Thank you very much.
Yes.